Hey there, I'm Dr. Laurence, and today we're looking at 6 science-backed ways to manage hypertension without medications. Whether you've been diagnosed with hypertension or you just want to take better care of yourself, this video is for you. When people find out that they have high blood pressure, one of the most common questions that they ask is, how can I manage this without medications? Today we're going to look at 6 strategies to help you just with that. And just before we start, this isn't me giving you medical advice. You should talk to your own doctor, as some of these options have some small risks. First up, salt restriction. Now we're talking about sodium chloride or table salt, not the chemistry definition of salt. And in sodium chloride, for every gram of sodium there is 2.5 grams of sodium chloride. Salt restriction works by having effects on water retention and the elasticity of our arteries. The average person following the standard American diet consumes 3.6 grams of sodium, which is 9 grams of table salt. The US guidelines on consumption of sodium recommend that people have no more than 2.3 grams of sodium, which is 6 grams of table salt, and the US Heart Society guidelines suggest that people consume less than 1.5 grams of sodium, which is 3.75 grams of sodium chloride. Most studies aim for under 1.5 grams of sodium, which reduces blood pressure by 4.8 systolic. Next, let's talk about a high potassium diet. Potassium helps with blood pressure hormones, the renin-angiotensin system, and helps with sodium excretion. Studies show that a diet of 4.7 grams of sodium per day significantly lowers blood pressure. This can be achieved by diet, supplementing, or mixing table salt with a mix of potassium. In fact, potassium supplementation alone can lead to a reduction in blood pressure of a full 3.5 systolic. Moving on to the third strategy, weight loss. Weight loss is a complex process that affects our kidneys, our hormones, our breathing, and our heart function. On average, every 1 kilo of weight loss corresponds to 1 point reduction in systolic blood pressure. For instance, a 5 kilo weight loss could lower blood pressure by 5 systolic points. The fourth technique is the DASH diet. This is a specific high blood pressure diet. The ideal diet seems to be a low sodium DASH diet. The diet itself is a high fruit and vegetable, high dairy but low fat dairy, and it is low in snacks, sweets, meats, and fats. The diet itself can lead to an improvement in blood pressure by 5.5 systolic, but when combined with a low sodium diet aiming for under 1.3 grams of sodium, there was an additional reduction of blood pressure to a total of 11.5 systolic. These effects in the DASH trials were seen as soon as 2 weeks into the trial. Fifth on our list is exercise. Aerobic exercise such as running, swimming, or even a brisk walk can have substantial impacts on blood pressure with reductions of 6.9 systolic. Unfortunately, strength training seems to reduce blood pressure by a smaller amount, and in some studies it showed a reduction of about 2.7 systolic. Finally, let's talk about alcohol reduction. 2 standard drinks of alcohol doesn't seem to affect blood pressure. But after that, alcohol increases blood pressure. For people drinking 6 or more standard drinks, reducing to 3 standard drinks could reduce blood pressure by 5.5 systolic. So there you have it, 6 scientifically backed ways to manage high blood pressure. So if you found this information helpful, don't forget to like and subscribe. Thanks for watching, and take care of your health.